all domestic flight operations to stop. All commercial passenger aircraft to be grounded.
With the curtailment of activity, with people not moving around, we will be able to have a circuit breaker in the spread of the virus.
India's big step to check spread of coronavirus. India enforces total lockdown. Stay home, stay alive. That's our top focus on India First.
India is being locked down to prevent the spread of this very dangerous coronavirus. Total lockdown in 14 states. Partial lockdown in 11 more states. Curfew in Maharashtra. There's been a spike in cases even in Kerala. 3 deaths reported today. 1 in Himachal Pradesh, 1 in Maharashtra, 1 in Bengal. Please keep in mind, viewers, there is clear and present danger. But is there light at the end of the tunnel? Dr. Sudhir Bhandari, Senior Professor of Medicine at the Savai Mansingh Hospital, Jaipur, who treated coronavirus patients with chloroquine, joins me on the broadcast, and we shall talk to him about this in greater detail. I'm Gaurav Sawant. As always, let's get started with the headlines. Top focus story on the broadcast. The Maharashtra government has imposed curfew across the state. Those who violate rules can now be forcibly remanded. They could be sent to a quarantine home. The situation is very grim. So far, there was a Janta curfew for 1 day. But from midnight tonight, this curfew will be strictly enforced by law. Public and private transport will stay off roads. Stay at home to stay alive. That's the message. Violators will be prosecuted. Sahil Joshi and Saurav Vakhtania bring you our top story.
Mumbai is facing an uphill task in fighting the coronavirus. On Monday, as more cases tested positive, Chief Minister Uddhav Thackeray imposed curfew across the state, which is already under a lockdown. Not just the state borders, but even district borders were sealed. Maharashtra Chief Minister Uddhav Thackeray said, and I quote, "We are at a turning point as far as corona spread is concerned. If we don't stop it now, we may have to face the same situation as many countries in the world are facing," unquote. The panic was palpable. There were jams in many parts of the city as people decided to leave the city.
This is an entry point to Mumbai. You can see how the police are deployed over here. I-cards are being checked. They have to show their I-card that people who are working with essential services, only they will be allowed to leave. Other people who have a medical emergency, they will only be allowed to pass through. Others have to take a U-turn and go back to their home.
State Health Minister Rajesh Tope made an appeal to people to stay at home.
गवर्नमेंट के जो भी मेजर्स गवर्नमेंट ने जो लिए हैं, गवर्नमेंट की जो भी सूचना है, उसका अमल करने का काम हम सभी लोगों ने एक आदर्श नागरिक के हैसियत से करना ज़रूरी है.
There were more alarm bells for Mumbai. In Dharavi, which is also known as Asia's biggest slum, a 68-year-old woman was found with COVID-19 positive, triggering fears of a community spread. With Pankaj Upadhyay and Saurav Vakhtania in Mumbai, Bureau Report, India Today.
India Today's Sahil Joshi now joins me with the latest from Mumbai. And Sahil, Kerala and Maharashtra, 2 states with the highest number of coronavirus cases. In Maharashtra, are these instances of those who've travelled overseas, or is there now real fear of community transfer, Sahil?
You know, most of the cases are of those who have a travel history, and the rest of the cases are of those who are in direct contact with the people who were either turned positive and their relatives. But there is one case in Pune of which even the health minister has tweeted about, is that they are trying to find out how she got the corona positive, and that's what they are trying to search for that. But right now what they feel is that they have been able to trace out from where these people might have got affected with the coronavirus. Most of the cases, as I've already mentioned, have some kind of a travel history, and they were having some kind of symptoms. And there are 3 deaths at this point of time. But more, scary part of Maharashtra is that now it has reached to 97, and it is growing. As Uddhav Thackeray is saying, that the next step, if we do not take care, will be in multiplication. It will not be added to the earlier number, it can be a multiplication. So that is the reason why this lockdown, what we are calling it, or a curfew, what we are calling it, is very essential, and that's what has been called in Maharashtra at this point of time. There is in Hindi, there is a word called Sanchar Bandi. That is a curfew which has been implemented in Maharashtra, and people have been given various instruction. Of course, the essential services will be on, but there will be no trains, there will be no BST buses available on the streets, there will be no state transport buses on the streets. Not more than 2 people can travel in a car. Even in auto rickshaw, there can be only 1 person in auto rickshaw, and that also, if the police stops, he needs to prove that he is going for he's part of some kind of a essential service, and that's why he is stepping out of his house. So it has to be that's
it's
strict.
very important.
The government has made it very clear that you have to stay in the house, you have to stay at home and stay safe. Only that is the way you can be safe.
Oh, absolutely. It's for the next 15 days. One really needs to be careful. Otherwise, India, it is feared, could go the Italy way or worse. And we'll tell you more about that in the course of the broadcast. Breaking news coming in from Kerala now. And this is a cause for serious concern. The biggest surge in coronavirus cases now in Kerala. 28 fresh cases reported from Kerala, which takes the total number of coronavirus positive cases in Kerala to 91. 25 of those tested positive had come from Dubai. There are 64,000 people who are currently under observation across Kerala. And I quickly want to cut across to India today's Gopi Krishnan Unnithan, who brings us this big story. Gopi, what's the reason for this sudden spike? Do doctors fear that we are sitting on a live health bomb?
Well, as on today, we have 28 new cases reported from Kerala. So that is actually the largest jump recorded in a single day. Now, coming into more details of these 28 cases, 27 out of these 28 are actually people who had returned from Dubai. So that is actually a huge relief for the state government, because even today there is no community spread which has been reported. And getting more into these numbers, this will actually take the total number of cases in Kerala to 95. Which includes 91 positive cases, which implies that there are 4 people who have been discharged and means they have been cured after they were initially tested positive. So we have 4 patients in Kerala who have been discharged from the hospitals. And this 28, further breaking it down at the district level, once again we have Kasargod district, the northernmost Kerala, with 19 cases out of this 28. So that actually tells a lot about the situation in Kasargod, and that also justifies why the state government had earlier ordered a complete lockdown in Kasargod district. 19 are from Kasargod, 5 from Kannur, 1 from Pathnamthitta, another 1 from Thrissur, and 2 from Ernakulam.
You need to be very, very careful as you report this story. Gopi Krishnan Unnithan, for the moment, many thanks for joining me. And for the benefit of our viewers, you must watch this. This isn't restricted just to Maharashtra or Kerala. People are now being urged to stay home across the length and breadth of this country. Why? Unfortunately, even educated people who know it's very dangerous to be out on the streets are out on the streets. Both the center and the states have now decided to read the Riot Act to those who violate the curfew. They could be arrested, they could be quarantined. This is a lockdown which initially is till the 31st of March. The aim is to break the chain of coronavirus spread. 75 districts across this country, 24.5 crore people out of 130 crore are currently under total lockdown.
India's fight against novel coronavirus entered a new phase on Monday. A day after the central government advised lockdown in 75 districts of the country, some states implemented it in toto and some are doing it in phases. The national capital came to a standstill. By and large, people stayed indoors. There were few violators too.
As Delhi goes under lockdown on the day one, how the violators are obstructing and destroying the purpose of the rules formed under the health emergency. Here the Delhi police on the road keeping not only a strict vigil but also ensuring that most of the people following the rules. However, on the first day, there are no challan, there are no penal action, there is no legal action, but very politely the Delhi policemen on the road requesting every individual to follow rules.
Those working in essential sectors were allowed passage. But they still faced teething problems on the first day of the borders being sealed.
मैं करीबन आधा घंटा फंसा हुआ हूँ. मैं नाइट ड्यूटी करके आया हूँ. अच्छा. इवन LNJP में हूँ. बट यहाँ पे कोई मतलब घर जाना है, फिर मुझे फिर से वापस ड्यूटी पे आना है. फिर
मैं स्टेट बैंक में हूँ. अच्छा. तो अब वो उन्होंने बोला था कि एजेंशियल सर्विस में आता है इसलिए आपको आना है. हाँ. अब हम जा रहे हैं, हमको जाने नहीं दिया जा रहा है वहाँ पे. देख इतना लंबा लाइन लगा हुआ है कि जाके वहाँ पूछ भी नहीं सकते हम.
The lockdown in Maharashtra, one of the worst hit states in India, was total.
The lockdown which has been announced by the Maharashtra government, it seems to be working. The most of the vehicles there on the streets, what we could see, are of those people who are supposed to go to their offices. They are part of the essential services declared by the state of Maharashtra. The essential services comprises of the banks, the Bombay Stock Exchange, the services which provides the electricity, the telephone lines.
Hundreds fled the city to return to their villages, only to be turned back. Tamil Nadu has ordered a lockdown from 6 p.m. on Tuesday, which meant Chennai is open on Monday. With Kerala witnessing spike in coronavirus cases, the Chief Minister announced on Monday a complete lockdown in the state till March 31st. The lockdown has sent hundreds of migrants into a tizzy. In Bihar, which ordered a lockdown, people climbed on buses to commute after train services was shut down on Sunday.
Bihar government has announced lockout across the state till 31st of March to break the chain of corona and to fight this menace. And it's the first morning after the lockout has been announced in the state, and you can see that there are a large number of people on the streets of the state capital. Though there are several shops which are not coming under the essential services, many shops are closed.
The centre has further tightened the shutdown. All flights have been grounded from Tuesday midnight. The motto for the nation is stay home, stay alive. Bureau Report, India Today.
So what does a lockdown mean? What does curfew mean, and who can come out and for what purpose? Remember, there will be very strict checking. That's what the police are telling us. Who all are allowed? Well, the police are allowed, doctors are allowed, those working at hospitals are allowed, fire department officials are allowed, and we're putting that entire list out for you. People who are allowed: fair price shops, electricity board, water board, municipal services. These are people who are allowed. Apart from that, of course, you also have journalists, print and electronic media, bank staff, telecom staff, internet, postal service, e-commerce, food and medicine related, those who are engaged in these tasks. Of course, they will also require a curfew pass. You need to have a curfew pass. That curfew pass is available at the nearest police station, at designated places. The head of the department will tell you where you get your curfew pass, get that curfew pass and then be out on the streets. Also keep in mind, petrol pumps will remain open. LPG agencies will remain open. All the essential, there is no need to panic. Essential services need to be out, they will be out. Others do not need to be out, they must remain home. Of course, also home delivery from restaurants will be permitted. I now want to bring in T.R. Kakkar, former Delhi Police Commissioner, who joins us on the broadcast to explain what the lockdown means. Also joining us on the broadcast is Dr. Rajesh Chawla, who is a senior consultant respiratory and critical care at Indraprastha Apollo Hospital, who will explain to you why you need to stay home for the next 15 days. But Mr. Kakkar, to you first, who all can come out during a lockdown? For example, if somebody wants to go and buy milk or go to a clinic tomorrow or go to a chemist store, can he go out? Does he need a curfew pass, he or she, sir?
You see, there are two aspects of it, Gaurav. One is that those who are on essential services, that means essential services declared by the government of the state. Now, since it is just not the lockdown, it is also the curfew imposed in most of the states. So once the curfew is imposed, curfew passes are issued to all those who need to be in the field to carry out various services. Now these are primarily issued by the district DCPs or the ACPs, whoever is authorized. They must get those passes so that there is no chaos on the roads as it was today. And the second question is whether people who have to go up to the milk booth or to the vegetable nearby. Now those issues are always overlooked because some sort of they do need something in their homes. So but the basic is that all these people must understand that this is a lockdown curfew which is for their benefit, and their cooperation is the most that is needed. Unless, you see, it is a curfew has been imposed in practically 80 districts, 90 districts, maybe tomorrow in a couple of more. It is not possible to fully sort of impose this in such large areas. Therefore, the cooperation will be needed, but I suggest those who are violators,
people must cooperate.
Those who are violators,
yes,
they could be taken to task. 8, 10, 20 people could be asked to that quarantine them or take them to the police station. That will send a message. But I'm sure people, since they responded so well on Sunday, they will probably do the same on other days now.
काफियों ने तो शाम को गुड़ गोबर कर दिया when they came out in large numbers to celebrate whatever was the, I mean there was no reason to celebrate.
Yeah,
but Dr.
Chawla, that was very bad.
जाने तो जहाने.
That was very bad, as if it is a
जाने जहाने. This is the message. This is the message that must go out. But Dr. Chawla, for the benefit of those who came out to celebrate in the evening, after observing Janta curfew, why is staying at home the difference between life and death at this point of time, sir? Dr. Chawla.
You must understand how this virus spreads. When you speak, when you cough, the droplets, they go to more than a meter. And a person who is infected, wherever he touches, the peculiarity of this virus is that it is alive for many hours, up to 2 to 3 days, wherever a patient touches. Let's suppose there is a building and there is a handle, and there is one patient who touches that handle and goes out. Now everybody who is going to come out and clap and touches that handle, everybody is going to get infected. This virus can infect many people's. The purpose of all this staying home is to break the chain. Means a person who is infected, if stays home, he will not infect others, because one person will infect 2 people, and then this disease, we are a country of 130 crore people, and it will just spread in no time. And whatever resources we have, whatever ventilators, ICU beds, we cannot fulfill if this disease spreads. The only hope our country has, stay home and stay alive. Because if we follow these 2 weeks and make this die, and then there will be very few people who suffer from this disease and will be able to overcome this. So that is the best hope for our country.
Okay.
By, we are 130 crore people,
Mr.
and 130 warriors showed yesterday that they can do it. So let's do it next 2 weeks.
Oh, next 2 weeks. Next 2 weeks is critical. And sir, I'll just come to you. Why are next 2 weeks so critical? But Mr. Kakkar, what about those who say, man, 6 in the morning, I'll go for a quick run, or I'll take my dog out for a walk. Why should that be permitted? Because they market jaake shopping to karni hai. You need to buy milk and bread and eggs and all of that. How does one ensure that they don't become carriers or asymptomatic carriers and infect others?
See, the question is all those precautions that the doctor has just said, when they go, let them not get together as a crowd. No, my understanding is that if they maintain that distance and spacing, perhaps they should be able to carry out with their little errands. But they must get back. They must get back. And, for 130 crore people, or maybe let's say 5 crore people, it is not possible to issue even the passes. But if they cooperate, things can be managed, and they have to understand that this curfew is not like any other curfew. This curfew is for their own safety, so that they can remain alive.
This curfew is for your life, your safety,
rather than anything else,
Oh, absolutely.
Your safety.
And because Dr. Chawla, the other big fear is that youngsters may infect either their children or their parents, and that is the reason next 2 weeks. Explain to our viewers, Dr. Chawla, why are next 2 weeks so critical? Staying home for 15 days could bring happiness for a very long time. Why?
This disease is spreading at a very fast speed, and it's a very infective. If this disease spreads to most of the population, and the number of cases, like in Italy, there was so large number, the healthcare system could not look after them. These 2 weeks, if we follow, if we quarantine, if we have even small symptoms like fever and cough, even if it is not tested, just stay at home. You will not spread this and you may get cured. And if your symptoms do not get better, then only you should contact the doctor. The basic purpose is that if the number of cases, if the spread slows down, the number of cases, they slow down, then the healthcare system would be able to look after. It is not that 2 weeks this disease is going to go. It is going to remain, but the number of cases would not be that large that the healthcare system cannot look after. Because, whatever the infrastructure and the resources we have, we cannot cope up. And the Italy, they're such a developed country where they had all the resources, they could not cope up because the number of cases were so large. And the other countries are now
hit the nail on its head,
Italy
Doctor.
and Spain.
When first world European countries are unable to cope, when they could not cope, what about a developing country like India? And that is why this lockdown, this curfew is very important. Remember, Italy did not follow this. And this comparison between India, what Italy did wrong, what other countries, how they did it, what are lessons for India, all of that and much more. And chloroquine. In what circumstances can one have chloroquine? That story, and those who violated this Janta curfew and other law, all of that coming up on the other side of a quick break. Stay with us.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.